Hello, my name is Dr. Neha Mathur. I'm a board-certified gastroenterologist with Bay Area Gastroenterology. Today, I would like to talk to you about irritable bowel syndrome, or IBS for short. Irritable bowel syndrome is defined by chronic abdominal pain and altered bowel habits without any underlying organic cause. It's considered to be in the family of functional gastrointestinal disorders, which is a very common reason patients see gastroenterologists. This can affect up to 30% of our referrals to the office and affects about 5 to 15% of the general population with their symptoms. Symptoms can be quite debilitating for many of our patients and can affect their quality of life. Symptoms associated with irritable bowel syndrome are broad, but include abdominal pain, diarrhea, constipation, alternating bowel habits with diarrhea and constipation, bloating, flatulence, belching, and dyspepsia. Given the symptoms are quite broad, a thorough history and association with irritable bowel syndrome must be done. The American College of Gastroenterology has considered a criteria called Rome 3 criteria to define irritable bowel syndrome. Rome 3 criteria for irritable bowel syndrome includes presence of recurrent abdominal pain or discomfort for at least 3 days in a month or more in the past 3 months associated with 2 of the following. 1. Improvement with defecation. 2. Onset associated with change in frequency of stool. And 3. Onset associated with change in form or appearance of the stool. The criteria should be fulfilled for past 3 months with symptom onset at least 6 months before the diagnosis. Thus, it's very important to talk to your gastroenterologist about your symptoms, timing of them, frequency, and specifics regarding your bowel habits. What is the culprit of irritable bowel syndrome, or the pathophysiology? The research is still ongoing to better define the underlying cause. Irritable bowel syndrome is thought to be from combination of altered gastrointestinal motility and visceral hypersensitivity. Motility can be altered from irregular luminal contractions of the colon, extended transit time in cases of constipation, and oppositely, exaggeration of motor response to hormones and certain ingested foods in cases of diarrhea. Visceral hypersensitivity is increased sensation in response to a stimulus. These hypersensitivity to the gut neurons can be in response to also intestinal distension and bloating. Various causes can be associated with irritable bowel syndrome. Demographics should always be considered first. Generally, patients are younger in age or female gender tend to be the more commonly associated gender with irritable bowel syndrome. Other factors, such as environmental factors of stress and anxiety, have been linked to irritable bowel syndrome. Diet also plays a role. Patients can have food allergies, carbohydrate malabsorption, and gluten sensitivity, which is not to be confused with celiac disease. Infections also are linked to irritable bowel syndrome. After acute viral or bacterial gastroenteritis, patients are 7 times more likely to have post-infectious irritable bowel syndrome. It is thought that inflammatory cells get released in this process to cause the irritable bowel patient symptoms. It is common to see this also after antibiotic use, which can alter the gut motility. Altered gut microbiome is also heavily being researched at this point. A gut microbiome is a collection of organisms and their genomes inhabiting different anatomical locations in both in and on humans. It is part of our immune system. It's complex and includes up to trillions of microorganisms. The function of these bacteria in our gut is to help with metabolism of dietary components, help with modulating our immune system, affect the intestinal motility, help with vitamin synthesis, help with recycling of bile acids, and cholesterol metabolism. We can also have bacterial overgrowth of bacteria in our gut. There has been a link between gut bacterial overgrowth, also called small intestinal bacterial overgrowth, and irritable bowel, and some studies show up to 20 to 80% link. The workup to diagnose somebody with irritable bowel syndrome must be done thoroughly. Remember, irritable bowel syndrome is a diagnosis of exclusion. Given that a lot of irritable bowel syndrome symptoms are related to real pathological diseases in the gastrointestinal tract, it is important that you speak with your physician about the comprehensive workup before labeling this as IBS. A gastroenterologist should consider blood work, stool studies, and imaging studies to include endoscopic evaluation with upper endoscopy and/or colonoscopy. Treatments for irritable bowel syndrome have come far with ongoing research. As we understand the underlying cause of irritable bowel syndrome, we can further attack the treatment to the symptom. Diet modification is a mainstay of irritable bowel treatment. Patients may choose to limit their food allergen if identifiable, or cut back on carbohydrate and polyol type food products in their diet. Incorporating soluble fiber has also been linked to show symptom improvement. Antidiarrheal agents such as loperamide or Imodium are also to be considered for patients with diarrhea. Stool softeners such as polyethylene glycol or Miralax are also shown to improve constipation states. Prosecretory agents in the colon have also been studied to show improvement. Antidepressants are used to guide pain modulation in the gut along with antispasmodic agents. Another area of research is serotonergic agents in drug form that help with gastrointestinal motility. Interventions to alter gut microbiome are also shown to be promising with pre- or probiotics and antibiotics for small bowel bacterial overgrowth. Psychotherapy must be considered in the treatment of irritable bowel, especially if environmental factors such as stress and anxiety are the culprit. Hypnotherapy and behavioral modifications have been strongly linked to improvement in symptoms. Lastly, natural remedies such as peppermint oil are also being studied and showing promising results. If we can be of any assistance, please contact Bay Area Gastroenterology.